Hi everyone and welcome to my channel. I'm Sarah Jane from Misunderstood. Now normally I would be talking about autism or ADHD, but today I'm going to be talking about the NHS. I have no idea how I even got round to looking at the NHS, but I did. A couple of weeks ago I came across a report that was written in 1988 called Britain's Biggest Enterprise, and I found so much evidence to say the NHS is gone. It was ideas for a radical reform of the NHS. Basically, a plan to how to privatise the NHS. They told us 30 years ago we would lose the NHS, and all everyone's ever said is, oh, I hope they don't, or we're in trouble if they do. But they are. They're on the last step away from completion. And they've done it right under the nose of everyone. Now anyone can look at this paper, it's on the internet for everyone to see. Now this report was written by two Tory MPs, Oliver Letwin and John Wedgwood. Now Letwin was an advisor on privatisation to overseas governments, and Wedgwood was an advisor to Margaret Thatcher. He also wrote a book called Stars and Strife in which he argues strongly in favour of the UK, asking America to take over our healthcare system. Now in this report they wrote about three different issues: what was wrong with the NHS, how the NHS could be improved, and the need for action now. So what did they say was wrong with the NHS? It stated that the staff were great, but the system itself was a bureaucratic monster that couldn't be tamed. It also stated it neglects the interest of patients and treats people as cases and constantly redistributes funds in incomprehensible ways. Well, we can't argue with that. It then went on to give ideas of how the system could be improved. They gave 5 ideas over. The first idea, the establishment of the NHS to become an independent trust. In 2005, only 7 years later, it didn't just become an independent trust, it became independent individual trusts. Step 1 had been completed. Now the second one was to increase the use of joint ventures between NHS and the private sector. Who remembers the protests in 2014 at Lewisham and Greenwich Hospital? This was over a £74 million contract to hand over some key local NHS services to private companies. They've been able to do this because the Health and Social Care Act of 2012, Section 75, which is the competition law regulations, it states any NHS service costing more than $615,000 automatically gets tendered out to the private sector. This act has allowed the NHS to become privatised. Now let's talk about the GP surgeries that have been sold out to the American company called Upper Healthcare. On the 22nd of February this year, 2021, a letter was written to Matt Hancock requesting an investigation by the Care Quality Commission under Section 48 of the Health and Social Care Act 2008. Do you know why? Because an American multinational company called Centene took over 18 medics, and they now own over 100 GP surgeries across London and as far up as Birmingham. Now Centene is the sister company of Upper Healthcare. Now this deal was made in a 9-minute meeting, and there was no mention of any takeover of the board of directors. During the meeting, which was only December in 2020, they actually stated there would be no change to the board of directors. But within 8 weeks, all directors resigned, and 6 directors from Oppose stepped in. One being Nick Harding, who set up Modality Partnership, but is now the Chief Medical Officer of Upper Healthcare. So how was this American company allowed to take over British GP surgeries? I'll tell you why. In 2004, only 5 years after they had written Britain's Biggest Enterprise, a bill was put in place that allowed companies that are not owned or controlled by medical professionals to run GP surgeries. This bill was part of the plan. Step 2 was now complete. Now the third idea was to extend the principle of charging. Well, that's already happening. If you don't want to go on a waiting list, then you can now pay for your treatment. Step 3 is in place. Now the fourth was to develop a system of health credits. Well, they've already got that system going in America. It's already in place to transfer into the UK. Now I'll tell you a little bit about the healthcare system they have in America. They have Medicare, which is state funded for the elderly, and then they have Medicaid, which is for the poor. And then they've got Obamacare. So I would say they have the plan ready for the fourth step to be complete. And the fifth was to put a national health insurance scheme in place. That's not going to be difficult. Well, that's what the Obamacare is in the UK, in the USA. They are so close to finishing the process of privatising the NHS. Now, the third issue that Redwood and Letwin wrote in the report was the need to act. Well, I think they've already acted. I can now see why Boris refused to answer when he was asked if they were privatising any more of the NHS. Well, I hope you found this information as interesting as I did. All the evidence I have spoken about is all online. You can also take a look at the links that I put below. Let's see how long this lasts on Facebook before it's taken down. Well, thank you for listening, and please subscribe to my channel and click the bell to be notified of every time I upload a new video. Thank you. Bye.